Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Dr. Nita Valens.
Well, hi there, Dr. Darrow.
Hello, Nita Valens. How are you today?
I'm great, and yourself?
I'm living it up.
Yay. I love when you say that. You know that. We've been opening the show that way for 11 years. Time flies, and we want our listeners...
Been a good time.
That's right. We want our listeners to feel like they're living it up, and we want them to be pain-free, and that's the name of the show, Living Pain-Free. So if you're having pain, which is orthopedic pain, basically musculoskeletal pain in nature, like joint pain, tendon pain, ligament pain, back pain, neck pain, knee pain, hip pain, arthritis pain. Perhaps you have dull aches or stiff joints and you can't really tell what's going on, but you know you don't feel good. You want to give us a call during our hour here at the studio at 866-870-5752. That's 866-870-5752. And when you call the program today, you get Dr. Darrow's latest book for free. It's called Stem Cell and Platelet Therapy. Regenerate, don't operate. And it has actually 264 studies. How about that? You can also go to the website and check out more about Dr. Darrow and the treatments at www.lastemcells.com. That's www.lastemcells.com. You can email Dr. Darrow off of every page on the site, and you can see him performing the treatments on video. We are here Saturdays at 10 a.m. and again at 1 p.m., just so you know where to find us. And if you've been listening for a long time, perhaps you're ready to call the office, make an appointment. The office is available for you to call 24/7. Someone answers or they'll call you right back at 800-300-9300. That's 800-300-9300. So remember, if you're having any kind of pain at all, that's orthopedic pain, basically. The number to call here at the station right now is 866-870-5752, 866-870-5752. Do you want to go talk to Susan in Westlake?
Why not? Let's kick off the show with Susan. Hi, Susan. Dr. Marc Darrow, and I understand that you have low back pain. How long have you had that for?
About a year.
Okay, and how did it happen?
It gradually got worse and worse. I constantly have minor lower back problem, and about once a month, my back goes out, and for about 2 or 3 days, I have to take Advil until the pain goes away.
Okay, so has that only been going on for a year, or have you had that many years and it just got worse?
Yeah, it's gradually gotten worse over the years. It's constant for the last year or so.
Okay, so that's very common. Just so you know that I'm not going to say it's normal. I don't know what normal means, but it's pretty normal. 80% of people get low back pain at some point. If you think about it, that's the fulcrum of the entire body. It's the middle point. And we're bending, stooping, lifting, and things of that nature. So the ligaments get stretched out. I'm going to bet you anything, no matter what your MRI says, if you had one or not, I don't know, you didn't mention it. But, your pain is most likely coming from what we call a sprain or an enthesopathy. Nita's favorite word.
My favorite.
Where the ligaments, tendons, muscles attached to bone is called the enthesis. It's very easy at that point in the low back to stretch that out, then have low back pain. It's also very easy to fix in most cases. with my line of work, which is regenerative medicine, we actually inject the area with either PRP, which is platelets from your blood, or stem cells that we can get from various places. And we can do the bone marrow. There's other ways to do it. And then we inject those right along the wrist and between ligaments and heal that up. It usually heals very quickly, typically about 4 to 6 weeks. And I'm not promising that's what you have because I haven't touched your low back yet, but in 1 second I can touch it and tell you if that's what it is and whether we can heal you or not. Most cases that is what it is. You have to be really careful because when people get x-rays or MRIs, they find all kinds of red herrings. Red herrings are things that are not real. They look real. When you get an MRI, you see herniated discs, facet arthropathy, arthritis, and things of that nature. But that's not necessarily what is generating the pain. So the hardest part of my job is educating people about this because they come in and they've been to different orthopedic surgeons, neurosurgeons, for a surgery, and they've already been indoctrinated into the point where they think they need a surgery for things that show up in their MRI when in fact they don't, and we get them healed up by just a few little injections. They can walk in, get injected, and walk. So it's a very conservative procedure, very simple to do, and I do it all day long with this technique that I've been doing for over, I think, about 22 years now, since my residency at UCLA, where I was taught how to do that. And I've been one of the pioneers. I've gotten it out to the world. We get about 60 to 80 new patients a month, and that's pretty much mainly what I do. We do some hormone therapy and age management therapy also, but most of what I do is orthopedics without knives. It's just simple percutaneous procedures, meaning we use a needle and go through the skin to the area that is the pain generator. So if you would like to come in, the phone number to the office is 800-300-9300, and I can tell you in a couple of minutes whether that's what your issue is or not, and whether we can help you. For those of you listening...
I had one other question. I use a machine. It's what's it called? Back to Health, or I think you endorsed it, and it seems it kind of stretches the back, and it seems to help. Is that of any use?
Well, yeah. I mean, when I was shooting that infomercial, it's not my product, so please don't call me to get one. There's a company that approached me and had me be their expert on an infomercial many years ago. And I had to be on my feet for 48 hours almost straight filming. And my back got very sore. So in my breaks during the shoot, I would lie on the floor and use that Back to Life machine. It's a great machine. But I'm not selling it, so I have to let you know that. Don't get a hold of me looking for it. I don't even know if it's being sold anymore. If you have one, it's a great thing to use. It helps with a continuous passive motion of just stretching out the low back and getting rid of a lot of pain that way.
So did I hear you say you inject the PRP and stem cells?
You can inject PRP alone. You can inject stem cells alone, and you can inject together. So there's a lot of different techniques for growing back tissue and stimulating new tissue to grow. Back in the day, when I first started doing this work, it was called prolotherapy. Prolo from the Greek word proliferate, or stimulate new tissue to grow. It's changed radically over the years to much better types of proliferation therapy. PRP and stem cells are what are used today.
And can you, I don't know anything about the anatomy. Can you explain again where you do the injection?
Sure. if you look at, if you search on Google for low back pain and hit the images up at the top left, give you pictures, because I can't show you pictures over the radio, but there are ligaments that attach, they originate at the L4 and 5 sinus process, and then they come out sideways to the top of the pelvis and the above the buttocks. So they're like guy wires hold you so you can stand up straight. And that's where the sprain is. Now, when people come in the office and I touch their back and I say, we can help you, and they go, what do you mean you can help me? I've been to 3 or 4 orthopedic surgeons and neurosurgeons who say I have to have surgery. And I start laughing and I say, you really just have a sprained ankle, but it's in your back. Are you going to have surgery on a sprained ankle? No. And it's not necessary to do it in the low back either.
Very interesting. Thank you very much.
Yeah, God bless you. And I don't mean to say that back surgery should never be done, but I am saying that most of the time it should not be done. I get so many cases where people come in after a failed back surgery, and then we heal them up using PRP or stem cells with simple injections. So surgery is not conservative. It's, to me, it's very dangerous, and people have a lot of terrible outcomes. So it sounds great, but anyone who has back pain who's talked to their friends who've had a surgery found that most of these surgeries fail. It's not a put down on the surgeons. I love the surgeons. They do the hard work. It's very demanding work, and it's very dangerous work. I'm just saying that most of the cases should not have surgery. And I don't care what part of the body it is. Be a shoulder with a rotator cuff tear, a knee with a meniscal tear. There's studies that show that fake surgeries of the knee work as good as real surgeries, so why take the risk?
There, Susan?
Thank you. I will call and make an appointment.
All right. The number to the office is 800-300-9300. And if you're listening and you want to call me right now and talk to me like Susan just did, I would love it. The radio phone number in the studio right now is 866-870-5752. I'm going to repeat it for you while you grab your pen. Sometimes callers say, I didn't get that phone number. Please repeat it. So it's 866-70-5752. Love to hear from you. And if you can't get to us, if this show is being played at some time when it's not live, you can go to the website at www.lastemcells.com. I just heard a little glitch there, so I'm going to repeat that again. Yes. It's www.lastemcells.com. And you can watch the videos of me doing these procedures. You can get a hold of me there. Every page has a spot to email me through the website. Love to hear from you. We get emails all day. First thing I do when I wake up in the morning is answer emails. In between patients, I answer emails. When I get home, after seeing patients, I answer emails. I'm usually up to about midnight answering emails. I love it. I love connecting with people. Every patient who comes in gets my cell phone number. How many doctors do you know that give it out? I love hearing from you, and I want you healthy, and I want you better. So my life is dedicated to healing, and I hope I...
Sounds great. That number again right here in the studio, if you want to talk to Dr. Darrow, is 866-870-5752. And thank you, Susan, for your call. That started us off. We're waiting for your calls. I have lines open for you. And I bet in the meantime, you have an email to answer.
Well, I have endless questions that all day. I get to all of them, and believe it or not, and I get to talk to a lot of people and answer their questions just through the website. So this person says, I had a total right knee done in 2007. Means they have metal and plastic parts instead of biological knee parts that they were born with. Some years later, my L4 and L5 disc caused me so much pain, discectomy and laminectomy had to be performed about a year ago. My left hip is also in need of replacement. Do you agree that the total right knee caused my hip? Well, there's a lot of information here in this question, so give me a break here and let me go through it word by word. So, person says that they had low back pain and that their L4, L5 disc caused so much pain that a discectomy had to be performed. That means that the disc, the cushioning between the vertebrae had to be cut out. And I'm not going to agree with that. Okay, I'm sorry. I've just seen too many of these surgeries done that shouldn't have been done and caused people much more problems. And then a laminectomy. That's part of the bone being cut out in the vertebrae. I'm not into those either. I see them fail all the time. And then the person says, now their left hip is also in need of replacement. Take the word need out of there. It's not a need. What did people do for 50,000 years before these surgeries were done? You know, the human being has been on the planet for 50,000 years. A lot of them had arthritis, their problems. They didn't go to a surgeon to get them cut out. What did they do? I don't know. I wasn't there. I do know for myself, when I have pain, I inject myself. I've injected my shoulders. I've done European stem cells on both my knees. I've used other things on my wrist, my right wrist, both of my elbows. I've had other doctors do my neck and because I can't reach there. It'd be dangerous to look in a mirror. I've done the front parts of my body, and then the person says, do you agree that the total right knee, my back and hip problems? Well, I wouldn't know the answer. A lot of times patients come in and they ask me questions, do you think this and do you think that? Sometimes I do know the answer, but most of the times I don't, and I tell them that I don't know the answer. And some patients get mad at me and they say, well, I came to you for an answer, and I go, I don't have the answer. Now, smart patients will say, thank you for being honest. I've been to too many doctors that just want to shoo me out of the office and give me answers that I didn't think were real. So I'm not going to be your cheerleader. Some people get mad at me for that too. They go, you're not being a cheerleader. You're not going to tell me I'm getting better or I'm going to get better. I'm not going to do that unless I think it's true. I'm going to tell you the truth the best way that I know how to deal with it. Sometimes the truth is not a happy answer. So there's a lot of things I don't know. I've been doing this work over 22 years, and I still don't know all the answers. I do know that it works on most people. I do know that it works on me. We know it works on Nita because I did her neck about, 15 years ago, 16 years ago?
Something like that, about 16 years ago, yeah.
That
was better in a week.
Yeah. And the first thing that I did was my wrist, and it was 50% better overnight. I've had other parts of me, the low back was injected by a friend of mine, better overnight. I've had other things like my shoulder that I did, it was better 100% overnight. The first time. The second time I injured it about a dozen years later, it took 2 treatments. I had a further injury about 4 years ago that took several treatments. So we don't know how soon you will heal. Please don't push me on those answers. And there are some people that don't heal, usually because they get the treatments too soon. I do not know how many treatments it will take to heal you. And it's a shame when people, they get a treatment or two and then go back to their surgeon who says, well, that can't work. And then people that stick with it typically get better. I don't know the answer on how many treatments it will be. I wish I did. And that's a hard thing for people not to know. A lot of people don't do the treatment because I have them sign a consent form that says there are no guarantees in medicine. I don't care what that is. I don't care if it's a surgery. I don't care if it's a medication. I don't care if it's a procedure. we never know if something will work. We can give estimates and we can tell people how many times it's worked on other people. We don't know on you. You are a study, an experiment of one person. So I'm sorry medicine is like that, but that's the way it is. Did we wait for the next caller?
Well, I was just going to say it's like that because every person's different. I mean, we certainly
every injury is different. Every disease is different. You know, we're human beings with different types of genetics and different kinds of backgrounds. And then we treat ourselves differently. Some people stay very healthy, and some people don't take care of themselves. One of the biggest issues I have after I inject someone, I tell them, you are not allowed to start exercising again until you call me and have me in writing that it is okay. And I say it in a funny way. My patients cheat on me too often. Yeah, they tell me they're going to be good, and then they're not. And I'm sorry. I have this happen every day where people come back and they go, I'm not better. And I go, did you play golf? Did you go running? Blah, blah, blah. And they go, no. And then their spouse is sitting there laughing, going, of course you did, honey. So if you want to get better, you've got to listen to the doctor's advice, okay? So part of that advice is leave it alone. Sometimes we have patients come in, they get a treatment, and they go back to work the next day. It's not going to help them heal. And then they blame me for it. They go, it didn't work. Go to another doctor. Well, I'm sorry, you didn't listen. So should we go to Julie?
Let's go to Julie in Costa Mesa.
Hey, Julie, your rotator cuff in your shoulder hurts. Which arm is it?
The right wing. I'm a tennis player. Quite a good one. And I have had the PRP previously, and I will just quote the MRI. You know that it's supraspinatus and the labrum, and but my pain is in where the bicep the deltoid unite.
Right.
And you know, it's gotten a little bit better. It's been close to 2 years. I've had several PRPs, but like I dropped something the other day, and it was very heavy, and that, you know, triggered it again to be painful. So I was wondering what you thought of that, and also somebody mentioned to me a BPC 157.
VPC 157. Not yet. I can look it up on the computer while we're talking. PC. None.
It's used for, I think, a multitude of things, but they were mentioning that, so I was just wondering if you had that experience with that.
You're talking about, I'm seeing it here, and is it a nasal spray?
Instead of the PRP, or maybe the PRP just isn't, you know, working for me, or... Yeah.
Well, here's what it says on the internet. It's a peptide, and it's derived from human gastric juice. I'm not for it or against it because I haven't used it. So I would suggest that if you think it's of value and the doctor who wants you to take it thinks it's of value, I would try it out. I'm going to try it out myself, because if it's something that you think, if the doctor thinks it's... Well, I use myself as the guinea pig all the time.
I know. I listen to you all the time. Mm-hmm.
May I ask if the PRP... Why don't you stick with us, because you've got some interesting things here, Julie. We're going to a break, but stay with us. We'll be back in a short while.
You're listening to Living Pain-Free with Dr. Marc Darrow. Grab a pen or a pencil. Write down this important information coming your way. I'm your host, Nita Valens, and we'll be right back.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.